Hi, I'm Warren Salmon, and I've been a professor in health policy and administration here at UIC since I came here in 1984. I teach the comparative health systems course, and I've worked with a number of students, doctoral and master's students, over the years. My beginning research came out of my experience at Cornell University when I started investigating the corporatization of medicine, and I continued to look at what was happening with the pharmacy profession when I was a professor in the College of Pharmacy. I've also been a professor in urban planning, and I'm very much interested in the Chicago scene and urban healthcare delivery systems too. My current course is in comparative health systems, and I found that it was worthwhile for public health students to definitely get a sense of what was happening around the world, where other people, other countries have been confronted with many of the same problems of cost, quality, and access, and have tried some different innovations, and that we could possibly learn from those in here reforming our healthcare system. The contentious environment with the partisan bickering over whither goes healthcare reform really overlays the problem that we have 50 million uninsured people. We have a crisis in quality and grappling with ways of being able to measure that and produce better outcomes. And we also have a problem with the fact that we are just spending phenomenal amounts of money and applying vast amounts of technology that has both large components of an inappropriateness of care as well as tremendous administrative costs. And coming from my background in management, it basically brings us to bear with how do we really find some better ideas for putting together our healthcare system in America. Over time, I've had some wonderful experiences in traveling and being able to lecture and teach abroad. I've had research projects in Asia and in Africa, and this has given me a nice set of not only health professional friends all over the world who I've learned very much from, but I'd like to bring that to bear in terms of teaching the students and sharing those experiences, because I've been diligent in trying to learn a lot about other healthcare systems. The course looks at a number of different countries, both in the developing world and in our developed world, in Europe, in the United States, and Japan, basically to see about models of care delivery that are worthwhile for us to consider in the public health work that we do. I've also been interested in urban healthcare delivery and worked extensively in the public sector here in Chicago with the city, the county, and the state, and basically trying to bring about more rational forms of cooperation and collaboration so that we achieve better effectiveness in the public sector. That's important in health policy, that's important obviously in the delivery of services. That cuts down on the cost, that improves the quality, and it gives us health outcomes that are very much needed for particularly our most vulnerable populations. The idea of being able to look at selected health policy issues in particular has been an interest of mine too, because the global things and the national health policy somewhat becomes a little overwhelming with its vast complexity. So focusing in on specific kinds of things are very important. And I'm currently doing research with one of our graduates of the School of Public Health, former doctoral student of mine, and we're looking at the medical malpractice insurance crisis and trying to figure out ways of easing the problems of climbing premiums for physicians and malpractice suits to bring it into bear with a little more rationality and a little less antagonism between patients and practitioners. Another area of interest that comes from the global health system interest is looking at the multinational, pharmaceutical industry and the concern as a public health professional for access to medicines. And that access for medicines is not just in terms of the high cost of modern pharmaceuticals and the inability of many systems around the world to be able to afford these things, but also trying to go ahead and get through either charitable, philanthropic sources, but to get some emphasis done on the neglected diseases that many people have to live with around the world. And the last area of interest that I've had that's been there, I guess, as long as the corporatization things, is looking at complementary and alternative medicines. Again, from my travels and understanding, different countries, other systems of medicine grew up in India, China, Japan, and in our own country, the homeopathic, the osteopathic, the naturopathic traditions and things like that. Many people today want safer and what they think is more efficacious interventions, and so alternative medicine has become a great growth industry in a lot of different advanced societies, but also becomes the medicine that most people in the southern hemisphere must rely upon because they don't have access to modern scientific medicine and pharmaceuticals. So these kinds of interests have all come together, and I try to bring them to bear in the comparative health systems course, and give students an opportunity to go ahead and think globally and understand some things outside of our narrow terrains of what we do in American health policy.